In osteology, as part of general anatomy, oftentimes they give questions about the classification of bones. The most frequent question that they ask is to classify the bones according to their morphology. So, when we're classifying bones according to their morphology, we are generally classifying them according to their shape, according to their size, and certain other structural features. Right. So, morphologically speaking, bones can be divided into the following categories. Firstly, we have the long bones. Secondarily, we have the short bones. Then we have the flat bones, followed by the irregular bones, followed by the sesamoid bones. Sixth is the accessory bones, right? So, what morphology must a bone possess in order to be classified as a long bone? A long bone possesses, anyways, in order for a bone to be classified or categorized as a long bone, it must possess a cylindrical shaft with expanded ends, right? So it must have a cylindrical shaft, and its ends need to be expanded. Also, the expanded ends are smooth and articular. Articular means that they will basically be articulating with bones at either end, and smooth because any articulating surface is covered with articulating hyaline cartilage and is so smooth. Long bones can be further classified into typical long bones and miniature long bones, right? The typical long bones, they possess considerable length, right? So we have the humerus, the radius and the ulna in the upper limb, the femur, the tibia and the fibula in the lower limb. Whereas for the miniature long bones, their principal feature is their short length, and examples of miniature long bones are the metacarpals and the phalanges in the hand, and the metatarsals and the phalanges in the foot, because these do possess a cylindrical shaft, albeit one with a short length, and two expanded ends known as the base and the head respectively. Now let's move onward to the second category, which is the short bones. What features must a bone in the body possess in order to be classified as a short bone? Short bones have almost identical or roughly identical length, width and height. So what this means is that they will look a bit like a cube. Now these short bones, they don't have a wide distribution. They're found at just two locations in the body, in the wrist, that is the carpi, and in the ankles, the tarsals, right? And most of their surface area is covered by hyaline cartilage, making that part articular. There are some non-articular areas for the entry of blood vessels and the attachment of muscles and ligaments. We do know that a lot of ligaments are attached to the tarsals in the foot. Also, we have the attachment and the origin of, not the attachment, the origin of intrinsic muscles. So we're done with the short bone. We have emphasized that for a bone to be categorized as a short bone, its length, width and height must be roughly identical and it must resemble a cube, albeit an irregular looking one. And we've given the examples of the carpi and the tarsals located in the wrist and the ankles respectively. We've also maintained that the short bones have a limited distribution in the body, being located just at the wrist and at the ankles where limited movement is needed. We have also given the examples of the carpi and the tarsals. Now let's move onwards to the flat bones. What features must a flat bone possess in order to be classified as such? Flat bones are thin, they are generally flattened and usually curved. So for a bone to be classed as a flat bone, it needs to be thin, meaning its thickness must be little, it needs to be flattened, and it needs to be generally curved. Examples of flat bones include our ribs, which are definitely thin, definitely flattened, and definitely curved. The sternum, which is thin and flattened and does have a curvature to it, and the scapula. These flat bones are made up of spongy bone covered on either side by a layer of compact bone, and these provide protection to the internal organs and also provide broad surfaces for muscular attachment because they are thin, but as you might understand. So now what about the irregular bones, and what features must a bone possess in order to be classified as an irregular bone? Simply put, the irregular bones. So in order for a bone to be classified as an irregular bone, it needs to have an irregular shape and have several processes. Now these bones, they simply do not fit into any other category, so we class them as irregular bones. Examples include the hip bone, the vertebrae, the bones at the base of the skull, and the facial bones, right? And a subclass of the irregular bones are the pneumatic bones, which have air-filled cavities known as air sinuses, and these are located in the skull vault, and they make the skull lighter and also give resonance to the voice. On the negative side, they are favored sites of infection. So examples of pneumatic bones they can ask this is the maxilla, the mastoid, and the ethmoid. If we talk about the bones of the skull vault classified as irregular bones, we also have facial bones. Now if we move onwards, the sesamoid bones, sometimes the sesamoid bones are erroneously classified as accessory bones, but that is not strictly true. So what makes a bone a sesamoid bone? These are basically bony nodules, so sort of like small seeds, and they're embedded in either the tendons or the muscles. Important point to note is that their numbers are not fixed, because in some locations these occur regularly, in others they occur with varying frequency. So the function of sesamoid bones is that they basically act as pulleys by providing smooth surfaces to tendons over which they can slide, and this enhances the ability of tendons to transmit muscular forces. In certain locations, these bones they protect tendons from repetitive friction and continuous pressure. Now you need to know the examples of the sesamoid bones. The largest sesamoid bone in the body is the patella, embedded in the tendon of the quadriceps femoris as it crosses over the knee joint. Other examples of the sesamoid bones, for example, there is a sesamoid bone located in the adductor pollicis, another one located in the flexor pollicis brevis, And in the foot, we have two sesamoid bones located in each of the two heads of the flexor hallucis brevis. So flexor pollicis brevis and flexor hallucis brevis. So if we talk about the accessory bones, they are known as such because they are not always present. Accessory bones have three subtypes: the supernumerary bones, the vermian bones, and the heterotopic bones. So how are supernumerary bones sometimes formed? When an extra secondary center of ossification, just don't write any ossification center, write secondary, and an extra secondary ossification center appears in a developing bone and does not fuse with the main bone mass, rather it forms a separate small bone, right? And the supernumerary bones are they're commonly located in the foot and in a radiograph can be mistaken for a bone chip. And examples include sometimes the os visualanium is found, sometimes the os trigonum. The os visualanium is found adjacent to the tuberosity of the fifth metatarsal when it is found. An os trigonum is found adjacent to the lateral tubercle on the posterior surface of the talus when it is found. With the vermian bones, they are found if they are present in parts of the cranium. They are found within the substance of the sutures, and they're sort of like bony islands, and the most common location is in the lambdoid suture. Then we have the heterotropic bones, which sometimes develop in muscles and other soft tissue. The most common example is the rider's bone, which develops in the adductor muscles of the thigh. Examples are important. Location is important in the muscle. Other soft tissue develop when the muscles are overused. Calcification happens, ossification happens, and name is the rider's bone. Particular location is the adductor muscle.